Hi, Bruno here. Welcome to Spainguru.
What are the differences in speed and accessibility between Spain's public and private healthcare systems, particularly in emergency situations and cancer-related care?
Now let's see the specific question of this Spainguru community member.
What are your experiences with Spain's public and private healthcare insurance system? Is it quick with private insurance? If there is an emergency, cancer diagnosis or surgery is needed, is a public hospital where you would go and be seen immediately or quickly?
Now let's see the answers of Spainguru community members.
First answer, a physician here. I work for the public system in Madrid. Both public and private systems work very well and have very qualified physicians. It's not a quality issue. However, the public system does see a lot more patients, hence there is a backlog for many elective procedures. 10 months for an elective MRI or to be seen by certain specialists was common. In Madrid though, they have been implementing strategies to reduce the wait list, so I would say the majority of things are now seen within a few months. I have both public and private. I use the private for elective stuff as it gives me more flexibility, purely by choice and for the luxury of scheduling appointments at my leisure. However, if anything serious happened to me or my loved ones, I would take them to the public hospital 100%. Public hospitals, as a general rule, tend to be teaching hospitals. There is more research, more resources, and more staff. For cancer diagnosis, there is a separate pathway and they see patients immediately. Next answer, it depends a lot on where you live. In Valencia, most of my appointments take less than 2 weeks. Only the ophthalmologist and the allergist took more than that, and it was less than 2 months. Next answer. There are waiting lists in all public services, even in private, just because they are so busy. But if waiting lists are long in the public system, they give you the option to go private and public system pays. Yes, definitely, there can be agreements between the public healthcare system and the private healthcare system, but this is something that happens on a case-by-case basis. It could be that in a specific comunidad autónoma on that year for specific procedures there is no agreement or it is limited, and it can happen that there is agreement. It is something that unfortunately it is not widespread all the time and is something that you shouldn't count with. Next answer. It does happen in Madrid. You can choose the public hospital that has the least wait, and you have the option of concertados that are public financing but are run privately, so function like private hospitals. Yes, there is a backlog, especially after the pandemic, but there are ways around it. The problem is most patients aren't aware of these loopholes. I know because I work at a public hospital. Next answer. It happens all time in Comunidad Valenciana. Personal experience and that of family members, over 6 months wait, they give the option to have it done privately or keep waiting.
And if you like this video, don't forget to like it and subscribe to the channel.
Next answer. Most of my Spanish friends who can afford it also have private insurance in addition to the public system for convenience, shorter waiting times, and no referrals needed for specialists. They do say, however, that if you have something really serious and long-term, the care in the public systems can be better. I've had 4 hospitalizations and surgeries with my private insurance, and the care here has been outstanding. So much better than anything I have ever experienced in the US. Next answer. The first and main criterion is your status in Spain. If you are not officially resident, then you will likely not be covered by the Spanish healthcare system. To get the best and fastest diagnosis or treatment, you will need to pay privately or through a recognized and accredited health insurance scheme. Next answer. We have both. Health insurance premiums are so inexpensive in Spain, it is perfectly feasible to have both options for far less than the cost of insurance in the US. Next answer. We had private insurance with our residency in Spain. I was able to make same-day appointments for immediate needs in a small town in Andalusia. My husband was able to see a specialist in urology pretty frequently. We usually had to drive to the town half-hour away for the more specialty doctors. It was good. The only issue I had was no one would answer any phones. I would have to go to the office to make an appointment.
If you want to read the full blog post, you can find the link in the video description below. In conclusion, according to Spainguru's Facebook group members,
both the public and private healthcare system have their pros and cons. The public system may have longer wait times for elective procedures and specialty appointments due to high patient volume, but it excels in providing immediate care for serious conditions like cancer. Private insurance offers shorter waiting times, convenience, and no need for referrals to see specialists. Individuals often choose to have both public and private coverage for a wider range of options. Availability and quality of healthcare services may vary by region. Overall, having both systems provides flexibility in managing healthcare needs.
And if you're searching for a health insurance fully compliant with any Spanish visa requirements, you can find it on Spainguru.es, where you have access to special rates using the self-service portal of the largest health insurance company in Spain, Adeslas.
Join Spainguru's community today. You can join our general Spanish immigration group and our dedicated groups for Spanish non-lucrative visa and Spanish digital nomad visa. Our groups together have more than 30,000 members. If you need expert professional advice, we got you covered. Just head to Spainguru.es and check out our top menu. You'll find immigration experts, relocation agencies, tax advisors for Spanish and US filings, sworn translators, apostille services, consulate appointment services, and health insurance providers for all types of Spanish visa applications. That includes non-lucrative visa, golden visas, student visas, and digital nomad visas, as well as medical certificates for visa applications and travel health insurance. Finally, I highly recommend you join our weekly newsletter, which we send out every single Monday morning. You'll get tons of information, questions and answers, feature blog posts, and news updates. Thanks again for watching, and we'll see you in our next video.